What is brain death? Brain death is a forensic definition of death. It is a complete shutdown of all brain functions and is irreversible. This means that due to severe and excess trauma or injury to the brain, blood flow from your body to the brain is blocked and the brain is dead. Brain death is the ultimate death. It's permanent. It differs from a permanent vegetative state in which the person is alive and some autonomous functions remain. It is different from an ordinary coma provided there is some brain and physical activity and function remaining, even if it is medically induced or intense. It is not the same as what is known as locked-in syndrome. Differential diagnosis can distinguish these different conditions medically. Brain death is used as a mark of legal death in many countries. However, it is described as inconsistent and often confused by lay people. Various parts of the brain can continue to function when others no longer do, and the term brain death has been used to apply to multiple combinations. A brain-dead person has no clinical evidence of brain function after the physical examination. It does not react to pain and does not contain cranial nerve reflexes. Among the reflexes, there is no pupillary response, fixed pupils, oculocephalic reflex, corneal reflex, no response to the caloric reflex test, and no spontaneous breathing. Brain death can sometimes be difficult to distinguish from other medical conditions such as barbiturate overdose, alcohol poisoning, sedative overdose, hypothermia, hypoglycemia, coma, and chronic vegetative conditions. Some coma patients may recover near the pre-coma or pre-coma level of functionality, and some patients with severe irreversible neurological dysfunction will still retain some low brain functions such as spontaneous breathing despite the loss of cortex functionality and the brain stem. Brain death differs significantly from other unconscious states. For example, a coma is like deep sleep, but no external stimulus can make the brain awake and attentive. However, the person is alive and retrieval is possible. Brain death is often mistaken for a permanent vegetative condition, but these conditions are not the same. A persistent vegetative state means that the person has lost higher brain functions, but the undamaged brainstem still allows basic functions such as heart rate and breathing to continue. The electrical activity of the brain can come to a complete stop or drop to a level that most computers cannot detect. Therefore, an EEG will be flat, but this is sometimes seen during deep anesthesia or cardiac arrest. In some countries, a simple EEG test is not required to confirm the death but is believed to have a confirmatory value. Life support machines are warm to the touch as they maintain breathing and heart rate. This gives the impression that the person is still alive. Family members may have false hope that the person is only in a coma and can wake up with time or treatment. Healthcare professionals need to explain precisely that brain death is definitive and that the person has died and has no chance to regain consciousness once again.